Hi everyone, thank you for joining us today for our webinar 12 Apps to Transform Patient Engagement. My name is Rebecca Cooper. I'm the Marketing Manager here with MobileSmith, and I'm going to be facilitating our webinar today. So just a few housekeeping items as we're getting started. You should have a question box on your GoToWebinar control panel on the right side. If you have any questions throughout the webinar, please feel free to post there, and we'll make sure we have some time for question and answer at the end. We'll also be recording the webinar, so if you have any questions afterwards, want to go back and review anything or share it with a colleague who wasn't able to join today, you'll get a link for that as well. So with that, we'll go ahead and get started. And I'd like to introduce our guests today. We have our CEO and founder, Bob Dieterle, and we have our VP of Product and Marketing, Dave Sawin. So with that, I'm going to turn it over to them.
Thank you, Rebecca. Appreciate everybody getting on the webinar today. This is Bob Dieterle, and I'm the CEO and founder at MobileSmith, and I'll be taking you through this research project that we have completed upon over the last few months. And we found some really interesting findings of how our clients have been implementing mobile apps to really make a difference inside their health system that is really solving or improving on key problem areas, not just in patient engagement, which a lot of them are, they're also solving other key problems inside the health system. And we want to share that with you because we really think mHealth is an exciting place to be, and I think it can definitely impact the health outcome for a lot of different hospitals out there. I'm going to take you through a little bit of our findings, and I'm going to turn it over to Dave, our VP of Product and Marketing, to take you more through the catalog of applications, specifically the ones that have been deployed and have been, really making a positive difference inside health systems. So I do want to introduce MobileSmith a little bit. We are a no-code platform that our clients, hospitals, are licensing from us, and they're able to design, build, and deploy and manage their mobile apps in their health system very seamlessly via the platform. And our platform is really transforming the software development process, as you see in this chart. And it's really needed in mobile to be able to test quickly and not to spend too much time in the prototyping phase of an application, because these use cases are very new, and a lot of the hospital apps we're going to show you, you're probably going to be like, man, I haven't thought of that use case before. That's a very new and novel use case. I wonder how that was proven out. And our platform is enabling our hospitals to test these use cases much quicker and get really good validation on, is it working? And sometimes they don't work, but they can actually at least be able to fast fail, we call it, in the agile world, to move on from that app without really expending too much resources and investment. And so we're excited about that transformation that's taken place, and we really think we're playing a big part of it. But first of all, what we're talking about here is, and we saw this a few years ago with our clients, they were deploying a lot of apps, and we were hearing from our clients like, hey, it's a great app, it won an award, and it's really nice, we love it. But we're just not getting the usage out of it that we thought we were. And then we also saw a report last year by Accenture that found the same thing, that while there's 250,000 applications in the app stores on mHealth, hospitals are just starting to come out with branded applications more and more. And I think that's very important in mHealth. I think that's the trusted source you guys are. People have come to rely on your health system for my family's needs, for everybody's family's needs. And if I see an app that's coming out for my health system, I'm in Durham, North Carolina, mine's Duke University. So if I see a Duke app come out, I'm going to trust it and I'm going to use it. A lot of these other apps are non-branded. Who knows who's building them out and what kind of background do they have? Are they two kids in a garage that's doing a diabetes app? Do they really understand the condition, or the experts in the field? That's always a big concern. But for the hospitals that have been coming out with branded apps, this report was along the lines of what we heard through our clients, was that they weren't getting the engagement that they were expecting from these hospital apps. And they've really been disappointed with the investment they were making in mobile. So we conducted a piece of research over the last about 15 months to really find out why, and what we found out was really a lot of cool apps that other hospitals have been deploying as well as our own, and finding ways that you can implement mobile to make a difference right out of the gate. So what we found at a high level is there's a couple of clients or hospitals that are trying to do this one size fits all. Oh, I want an app. I just want a hospital app, a branded app that are all our patients just need to download once. They never have to look for another app, and they'll have everything in there. It's sort of a website type of philosophy, and for websites, it's important to keep your keep your customers, your patients on your same domain. And the way you work with web is you have everything there, and you kind of tunnel through to what you need. Mobile apps, it doesn't work well. You have to be very target and very specific in how you provide function to someone using mobile. And if you think about how you use mobile apps versus the web, you use it quite differently. You info snack more on mobile. You're looking for very specific content, very specific function. You're not looking for everything. And so that's been one of the problems we found, that they're trying to do too much. And it creates a few things. It creates it very hard to navigate. I'm a healthy person. I don't need to navigate all these conditions, swipe through a bunch of apps I'll never use or functionality to get what I need. And in other cases, it was the hospital systems were taking way too long to get their big app out, connect everything up, have all their back-end data connected correctly, and they weren't really testing the market either. And then these functions weren't really vetted with the target audience. Since it was a big app, it took a long time to get out, and they didn't do a lot of piloting. They didn't know what worked or what didn't. And one of the big things is hospitals, just like anybody who's buying software, is looking for an ROI. What value am I getting out of this? And initially, it seemed like a lot of our hospitals and what we've seen in the market, they were interested in the shiny object syndrome. Oh, our competitor has an app. We need an app. Well, what kind of app? I don't know. What does our competitor do? Let's just do what they're doing because we need to have one. And they didn't really have a strategy of how mobile could really make a difference. And they came out with a nice app and looked great, won some awards, but then people weren't really using it for some of the reasons we said above. Or if it was a general hospital app, it was kind of like a glorified brochure. Yes, it's nice to see all the service lines and all of the locations and the hours and things like that, but that could only be so engaging. It doesn't really help you if you have an acute health situation or if you're managing a chronic condition. So we've actually added this, and we're kind of giving you an answer a little bit before we dive into the different use cases that we're seeing. But what we've been actually working with a lot of our clients who've been having this trouble, we've been kind of plugging in to the areas that, the strategy areas of where they're making decisions on what apps to deploy. And a lot of hospitals are forming these governance groups, cross-hospital groups that have the different service lines as part of these committees, and marketing and IT and business managers and stuff. And they're looking at app ideas and trying to vet them and sort which ones can make a difference. And we're getting plugged into that. I'm personally actually being invited to a lot of those meetings. My background has been very helpful for a lot of clients. And if you're interested in plugging in at that level in terms of helping sort your mobile strategy out, or even presenting any of the stuff we're presenting today, if you would like to have your committee, your digital strategy committee, your mobile center of excellence, or your governance, these are the different names I've been hearing. We'd love to present this data to you because it's been transformative to a lot of our clients. But what we're seeing is, the way you approach mobile, first of all, beyond the apps that we're going to show you is, you want to think big, obviously, how mobile can really transform some of these service lines, but then start small and act fast. Don't wait too long to get something out. Start with a nice small prototype. Don't try to put everything in that you're thinking it needs to be. Start with a pilot group and get quick feedback. Our platform is very well suited to enable that process, and that way you're able to keep moving forward or decide this isn't working, which again is very valuable. And then some of the get quick wins on the board, and again, the catalog of apps we're going to show you in a minute, we've seen a lot of hospitals be able to do that. They've been able to deploy them quickly. And these apps we're going to show you do not need to be connected to the EMR or your hospital record. Now, they're going to get better over time as you connect your EMR, but almost every client we're working with, that is a project that's taking many years to kind of expose the data in a mobile format that can be consumed in an optimal way. And that is the direction that we need to go to, but you do not need to wait for that. And these are small pinprick apps, very targeted applications that are addressing acute health situations. Like I'm healthy right now with my family, and I don't really need to engage with Duke University. But when my son threw his shoulder out playing baseball and he needed to get surgery, I was incredibly engaged with Duke at that time. They didn't have an app for me to get educated on his problem, to deal with his pre-op situation for his surgery and his post-op and his recovery and all that type of stuff. I was super engaged. I was doing my own web surfing and stuff. I really wish I had an app for it. And these are the ones that we're going to show you. And then launch prototypes and refine the use cases. Mobile is a new, it's unproven in a lot of ways. And so you're going to be able to evolve and say, this didn't work, but this is working well. Let's do more of this function. And that's very important to keep iterating as you're getting feedback. And then measure the ROI. Up front, make some hypotheses around how you think this app is going to improve, for example, more bariatrics patients making it to surgery. That's a big problem. Less last-minute cancellations of tonsillectomies. That becomes a big problem for you, right? That's some of the things. Having less acute emergency situations of people not managing their diabetes very well. Measure some of those things, and then over time, see what improvements you're making and how the mobile app is lending to that. What we see in hospitals right now, and you might be seeing this as well, is everybody has an app idea. Where's the ROI? In the groups they might be coming to you now. I think an app could work in this area or that area, and that's kind of getting back into, getting plugged into your governance teams. We have a very good framework, which is a topic for another webinar, that helps hospitals vet the ideas. So if you're having your own ideas, how do you score those? How do you make sure which ones you want to invest in first? Because you can't do 5 apps at one time. You're going to do them 1 or 2 at a time, and you're going to build a roadmap, and you have to prioritize them. And that's very important as well in this process. Now let's go to our catalog of applications. We call them hospital app blueprints. If you're a licensee of MobileSmith platform, you'll get these blueprints standard package into your account. They're template-based applications that our clients have deployed, and they're in areas of, as you see here, pre-op and post-op is a really good area to leverage this. And they're actually prescribing the app during that process. When you're signing up for your surgery, hip replacement, they will, when you sign up for stuff, they usually give you a packet of information, right? It says, here's all the information you need to learn. Don't lose it. And it has a prescription of your pre-op process and all that. Well, now they actually will give you a QR code, and you can download the app as you're signing up for surgery. So you don't have to put a lot of marketing in a lot of these apps in a broad way. You could just put them up on the app stores, and then as the patients are getting scheduled, it's very easy. We've had a lot of clients that have been doing that. It's just part of their workflow process. They say, oh, please download the app as well, and I follow that pre-op process in there. And it also has a lot of education that you can do. Other areas, condition trackers, population health, managing diabetes and COPD, and those areas where if they're not being managed well, it becomes big problems for the health systems in your communities that you're doing. Care coordination is another area. And you see some of the areas right here, and I'm not going to steal all of Dave's thunder, but bariatrics is huge. Maternity, that is more, again, it's a process during 9 months where especially expectant mothers are very engaged with their baby. And the pregnancy, and having an app that tracks that process along has been very successful and deployed many times within our clients. Diabetes, discharging with very specific instructions. Emergency room is another big area of interest where you have a lot of non-emergent patients coming into the emergency room, clogging it up, while you have all these other urgent care and clinic options that are available that you don't realize that are there. And we have clients deploying those differently, which Dave will take you through in a minute. Hip replacement. So go to the next page, please. So what is a blueprint specifically? It is a complete turnkey package. You get a sample app that's a templated app that's in your platform that you could easily rebrand and customize to your specific experience. So it's a starter kit. It gets you going quickly on getting that app developed. If any of you using those, website builders, Wix, Squarespace, you usually build from a template. to build that specific website. So that'll be the same type of approach here. You also get app design guides. You get a branding guide of how the graphics should get sliced up and get brought into the platform for your specific branding. And even more importantly, we actually have a strategy document, or a solution brief we call it, that talks about why a mobile app is impactful in tonsillectomy or bariatrics. It goes into more of the KPIs and more of the target demographic and the problem areas. And a lot of our hospitals like that because they use that to help get buy-in in their hospital processes, to say, this is why this app could make a difference in our area. Look at these KPIs, look at the problems that they're solving and why. And usually when you have a domain expert in your service line that looks at that, they're like, yeah, I do think that would work. Let's try this. And then also, we're coming out with more and more case studies of actual clients that have deployed it that actually show the results of those deployments. So it's a full turnkey package that we feel that hospitals could quickly drop in into areas that your workflows aren't super unique. They seem to be very common across hospitals, so the workflows don't have to change significantly at all. It's mostly helping your patients manage their condition outside of your facility. At the end of the day, these apps are. If you have a pre-op process where they're at home and have to manage that, this app helps them do that. They have a chronic condition where they have to be at home again to be regularly managing and getting reminded to exercise and eat healthy and stuff. That's a lot of what these apps have been doing, have been proven very successful. So, and with that, I got a lot of questions from clients or prospects that haven't done MobileSmith saying, man, we've tried to do one mobile app and it's okay, but it's been really hard to kind of keep it maintained and stuff. And I can't imagine trying to do all these applications. And when the new iOS 11 comes out, or the new version of Android operating system, it's a big headache to make sure all these apps are working well with the new operating system and testing them and redeploying them. The MobileSmith platform does that for you. That's really the benefit of our technology, is we bake all that in. So once you've deployed these apps, it's much, much easier to manage them going forward. So you can theoretically have 5, 6, 7, 8 applications that you're managing within one console. We bake in all the OS updates, all that type of stuff works right out of the box for you. Plus other areas you see here, design and prototyping. We help you build quick prototypes and get it out to your stakeholders. It could be within a matter of a couple days to get quick feedback. And the development, deployment of the application, we help you get it up on the app stores, or even do a private internal deployment if that's what you want, if you don't want it in the public app stores. And then, like I talked about, the maintenance of the applications once you have them out is a big value that the platform does provide. So with that, I'm now going to turn it over to my buddy Dave. We've been together a long time doing work together, and I'm glad he's at MobileSmith now. He's my VP of Product and Marketing. And Dave, welcome.
Thanks, Bob. I appreciate you giving that overview. What I'm going to do is get into more specific, what we call blueprints. And what this is, Bob referred to the fact that we've worked with a number of different hospitals around the country and looked at the best practices of applications that they've built, and then they've actually been able to measure, measurable results, or KPIs as we call them. And these KPIs could be anything from, the cancellation of surgeries going down, which has a real dollar value. It could be, reducing printing costs. It could be also something like preventable readmissions, like fewer readmissions post-operation, or just patient satisfaction scores, because they can find their way around the hospital better. So what makes something a blueprint is that it's a measurable ROI. It's been done before. We've already built it, which means you can deploy it quickly. Think about a blueprint of a house. You can quickly deploy it. You can change it however you want to. You can change the fixtures, the colors, the branding, however you want to change it, but it's a proven application. And the first area we're going to cover, these are all organized around problems that we've heard that you have. The first one is emergency room overcrowding, and also the patient experience associated with that. And so here is an example of an ER urgent care app, and the goal of this is to reduce overcrowding and boost satisfaction. Now, not every hospital has an ER overcrowding problem. If you do, this is a great app for you to deploy quickly. You can get the people into the emergency room, give them this app. They can scan a QR code, download it, and they can start exploring things like do I really need to be in ER, or could I actually be seen in urgent care? And they make that decision themselves. Wait times at local urgent cares, how quickly they might be able to go and be seen somewhere else, or just things like we've had some customers implement just dwell time. So I've been waiting for 30 minutes and I get a pop-up message that's very powerful and tells you, what you can do next and what you can expect. A related application we call the Hospital Wayfinding or Concierge app, and some of our clients have actually built these two apps together. Some of them keep it separate, but in this case, you think of this as like your general patient app for your healthcare system, and they're looking for things like locations and directions. And you would market this, you try and get all of your patient client base to download this through traditional means. They can find urgent care centers quickly, they can find ERs quickly, and once they get to one of your facilities, they can use blue dot wayfinding to find their way. What's even one step better than that blue dot wayfinding is location-based messaging. So, for example, you come into the lobby or waiting area of one of the facilities, and immediately a pop-up message comes up and tells what to do next. Come straight ahead and check in. Click here for wayfinding to your location. So the location-based messaging is also a big help there. So that covers the first area. The next area we're going to cover is driving patient volume for service lines and then also activating those patients. And the first one we'll cover is service line marketing for a pregnancy application. So again, we've done literally 20 or 30 of these for different hospitals already. It's very popular. A lot of the younger expectant mothers and fathers these days are in the digital age. They're not going to go out and buy a book. They want everything that they want to do associated with that very special time in their lives to be over their mobile phone. So we illustrate the different milestones. So this is one of our powerful technologies that we've built in, and you can use quickly in any application. We'll talk about this a lot as the milestones. It allows you to set up certain key milestones in any sort of a medical condition, in this case pregnancy, and then allows people to interact with that and see what's coming next, what they need to do next, and so forth. And then there's a whole host of interactive tools that kick counters, contraction timers, being able to take pictures and send to all of your friends and family. And then finally, appointments, being able to keep track of when appointments are and get automated reminders when those appointments are coming. The next one is the bariatric center. So this is another service line marketing as well as patient activation. This represents a very interesting area where, for example, lots of new bariatric centers have been opened, but it's very difficult to get someone from the information session all the way down to actually being able to have the surgery. And so what this does is it sort of helps every step of the way. So one of the first barriers is just the information session itself. Many people don't want to show up, but you're required to have these information sessions. What you could do is you could build the information session into an interactive video on the phone. And this is one of the ways, and this will be a theme, how mobile phones transform healthcare. It's not just like Bob said, moving your website onto a mobile app, but this is something you couldn't do really with a website before, is get these milestones and information sessions in front of people and prompt them. So then staying on track as they go through, I think, what was it, one of the recent statistics we looked at, Bob, in terms of what's the percentage of people that get from the information session that actually
yeah, I mean, it's actually we have 3 or 4 clients right now that it's like between 30 and 50% of people who go to the info session don't make it to the surgery because there's a very exhaustive 3-4 month pre-op process where you have to actually get healthier, lose weight, and you have to hit certain metrics to get in. And this mobile app is one that's really helping them stay on track. And if they could just start moving the needle from 5% more people making it to surgery, think of the revenue there. Now, just real quick, looking at this template here, you see this Graywin Healthcare. That's a fake name that we use as just kind of our fake hospital we created some graphics around it. So a template like this is what you would see in the platform. Like, so you say, man, I really want to have a bariatric app for my center. You see how it has an info session function, a my surgery, my weight goals, my health. That would be all pre-built for you, where then you could just start replacing the gray win branding with your branding, and we can help you through all that. But it's already pre-built, ready to go. And if you're like, man, I do like that app, I want to build it from that, that's how the template would work.
Well, thanks for that. I'm going to move on to the next problem that we hear about is population health, also improving adherence. And the first blueprint that we'll look at here, this is a generic template that is actually reusable for a number of different types of procedures. So we just generally call it the pre-op, post-op. And just think about it in terms of a pre-op checklist. So any sort of procedure, there's going to be a checklist. They come in for the first visit. They get a stack of papers with their discharge summary for their first visit, and that stack of papers quickly finds the floorboard of their car, and they never actually do these pre-op procedures. Some people do, some people don't, and that results in cancellations of actual surgeries or procedures because they didn't actually follow those steps. Now think about a mobile phone. Research shows that people look at their home screen on their phone between 80 and 100 times per day. Now if one of these reminders that they need to do pre-op actually shows up on their messaging screen on their phone, they're a lot more likely to do that. So it's not just moving or digitizing all those pieces of paper and putting it on a website. This is actually prompting people. This is transforming the experience, not just digitizing the experience. So now you'll see far fewer canceled surgeries. And then post-op tracking, think of it the same thing in reverse. After a surgery, there are certain things that the patient needs to do to take care of themselves, and if they don't, they're going to end back up in the emergency room because they're the healing is not happening properly. They'll have more calls to your call center, and a lot of that can be preempted just by giving them the information that most post-op conditions follow a fairly linear sequence of known events. The human body doesn't change that much from person to person when it comes to the big milestones post-op. Now, just to give you an idea of what some of these could be and some of the apps that we've already built, think of a tonsillectomy app. So this is a good example of both the pre-op and the post-op are very important. If that tonsillectomy patient shows up, having eaten within 24 hours, surgery canceled. Or the other point is after a tonsillectomy, usually it's children, on the third day, the children just feel terrible. And the parents want to bring them back into the ER and say, there's something wrong with my child. Now, this is a very normal condition. The third day just really hurts. There's not much you can do about it. So if you prompt them and say, hey, watch out, day 3 is really going to hurt, and why don't you watch a video here of why that is, that's going to dramatically reduce the number of parents who, parents know what's best for their kids, which means they often bring them to the emergency room and they don't really need to be there. So again, that's a good example. Another one that's very heavily more on the pre-procedure colonoscopy. About 10% of colonoscopies are canceled because of the pre-op, and that varies dramatically whether it's a surveillance colonoscopy or just a screening colonoscopy. As many as 50% of screening colonoscopies are canceled. So if you get people to follow these procedures, my mother-in-law just went through this, and again, we were always searching for that piece of paper, what she could and couldn't eat, and what she needed to buy at the pharmacy. So again, putting those into milestone messages that are actionable is what really makes the difference for adherence. Trying to think of a couple of the other pre-op, post-op. What's another one that we're doing, Bob?
Well, we have the hip replacement, the knee replacement. What's nice about this is each of them have the same pre-op and post-op process pretty much if you're doing hip replacement, knee replacement. That's why you can create a very specific app for that and deploy in our platform. Again, if you can cut and paste a lot from one surgery app to another in our platform and make it very easy. But it's those reminders that are key. It's not anything sexier than that. It's, I'm looking at my mobile screen right now, and as my phone is right next to me, if I got a reminder popped up, it's 3 days before your tonsillectomy, tap here, and oh, you got to go get your prescriptions now filled, or you need to stop eating this type of food at this point. It's very effective. this is the one area that I was really excited to find out because I just had to go through it myself personally with my family, and I wish I had more of that process because I did lose those instructions in the house, and I had to ask for them the second time. I had to call them up and say, "Can you print out, fax me these instructions again?" It was very frustrating. I wish I just had an app that had it all there.
You probably just cost them another $100.
Yeah, that's another thing. A lot of our clients are seeing they're saving $50,000 of printing costs because they don't have to do all that now, and that's just the cost of the ink and the paper. Think about the people time and stuff, not having to field the phone call, print it out, and do all that. So, sometimes it's just that kind of savings besides the patient engagement side. There's nothing worse than I would think if I was going in for a tonsillectomy and I forgot to remind my son not to eat, and I roll in 8 a.m. and I can't have the surgery now, and I'm all disrupted. I have to go find another time I got to take off at work. Not only is it a problem for the hospital, but you're scrambling to try to find someone, probably calling everybody up. Hey, can you make an 8 a.m. appointment now? We want to move you up because they want to fill that slot up. A lot of times they can't do that. So they lose, the hospital, you guys lose, and then the patient is upset. So, these kinds of apps, even though they seem so simple and very targeted, it can be very effective for that patient group. And if you really want good, engagement and HCAP scores, you do it by, patient segment by patient segment, and it can be really impactful.
Yeah, so it's as simple as loading a different milestone file. As you pointed out, there's a file that has all the different milestones listed by, timestamp, pre-surgery, post-surgery, and then swapping out the graphics, and you can really make this into just about anything possible.
Yeah, so you have a very specific pre-op just for your hospital. You can customize it very easily beyond what's in the template.
Yep. So let's go to the next one. This is also kind of a family chronic disease management. So these are, again, a family of different templates or blueprints that are really aimed at population health and also adherence. And again, also preventable readmissions. Often these chronic conditions are people that they have a procedure, and they're the ones that more likely end back up in the hospital. So this one, diabetes, we're actually running a great study with a hospital where they are, I think they're saying $2,500, Rebecca, you might remember, $2,500 per year per.
The difference in insurance costs for well-controlled versus poorly controlled diabetes, or just among their employees and the employees' families that are diabetic.
Exactly. And so what this does is it allows the employees of the hospital and their families that are covered by the hospital group to get better control of their diabetes and reduce their insurance premiums. Now they're piloting that with their employees and their family, but then once they do that, rolling it out to their entire patient base. Another one is, and these all kind of have the same formula, COPD. And so again, you can assess what your status level is of COPD, or you can punch that in if your doctor's already provided that to you because of a test, at the facility. And then you can track your different health goals with respect to controlling your COPD, and then just a number of helpful benefits in turn, as well as you can implement, one customer's implemented like a panic button. If someone's having a really acute, difficult situation, breathing, they can push a button and it actually gets them connected to the proper place right away. So a couple other ones that we're working on, these are just two of the chronic condition trackers, but we have one, congestive heart failure, another one that we are working on. It's not complete yet, but again, this is kind of a formula you can go through with a number of different of these conditions. Okay. Now going to the next one is engaging your physicians and facilitating referrals. So this is more of an internally facing application, the physician referral application. And again, a number of our clients have done this. And really the goal here is to, a lot of the nurses that handle the referrals or the doctors don't necessarily have the information right in front of them to facilitate the referrals within their health system, particularly the doctors. And so they just need a quick app to say, this is the doctor you should see, instead of maybe that guy was the one he should have recommended 2 years ago and he forgot, and that one's no longer affiliated with your health system, so the revenue just walked out the door. But it also allows you to look up the physician profiles if you're not familiar with a particular area, which ones that you trust and so forth. It may also be just a good reminder. Then finally, it allows you to provide locations and directions quickly on how to get to that referral. So again, just sort of wrapping up, this is the last blueprint that we'll cover today. And in summary, if you go to the last page, these are just some of the many different hospitals that we work with. We've got more that have hit this list just in the last 3 months because of these blueprints. We deployed the blueprints, what was it, Bob, maybe 2 months ago?
Officially, I think it was like around November, yeah.
Yeah, and already just because of that capability, we've added about five new logos to this page. I haven't even gotten them on here yet. But having said that, really the next step for this presentation is we really want to open up the floor for questions. So I'll turn it back over to Rebecca to see what questions have come in.
Thanks so much, Bob and Dave. And yes, just as a reminder, if you guys do still have questions that you haven't entered, you can go ahead and do that in your question box on the right-hand side. We'll go ahead and tackle a few to start off with. Bob, you mentioned specifically, you referenced earlier the EHR. There were a few questions regarding that. Can you get insight a little bit more about how these blueprint apps work without connecting to the EHR?
Yeah, as we've talked about, pretty much every health system I'm talking to, or our sales team has been talking to, our clients are working on their electronic health records and trying to expose them for mobile consumption, which is not super simple. And specifically around prescription management, online appointments, things like that, besides your health record, is a work in progress, and it's going to get them there at some point. And so what we really liked about these applications are that you don't need to have your EMR connected to be impactful. And you've seen a lot of the use cases that Dave and I have already described. It was more around you could easily add your videos, upload your content, create these milestones for your pre-op prescriptions and post-op processes that you want your patients to adhere to when they're not in your facility. So they're simpler in nature, and they get you those quick wins on the board. So as you are getting your EMR ready, you can connect them up to those apps at a later date. We do have, and I'll let Dave talk about this. Why don't you talk about the connection points for the EMR that we have in our platform currently?
Yeah, so we do have the ability through connectors to be able to connect to most of the top EHR systems. It does carry with it a lot more complexity and cost to be able to do that, but it is fully available. Again, the recommendation, one of our recent customers that we just onboarded, we had an event where we all came together, and we had the connectors, we had the EMR programmers there.
It was a hackathon, right?
A hackathon, and just couldn't quite get it done, and mainly just because of the level of license that hospital had, and they didn't quite have the latest API to expose to us and so forth. But we're going to get it done, and we found the way. Basically, they wanted to get the patient portal integrated into the general patient app that I showed you. And so basically, they got the patient portal in anyway, but it's just a mobile web. It's not the ideal way. You can't connect all the alerts together, but it works, and it's actually good. And most of the patients, they're extremely happy with it. So that's really the story of the EMR is that it's doable. We can get it done. I would say get the apps out first, and then build the phase 2 project, because the connectors to the EMRs, they're not all ready to do this yet. They're not all particularly mobile friendly yet. So it'll take, you could get your app out in 6 weeks, 2 months. The EMR portion might take 4 to 5 months, 6 months, and so forth. Now, every hospital is different. You might have your EMR perfectly conditioned for mobile, and we walk in and get it done the first day. Not saying that's not possible, but it's just it's something that's doable. But again, we're seeing that more as a phase 2.
Great. So we talked a lot about ROI. Can you talk about whether MobileSmith creates the ROI for apps developed, or is that more the responsibility of the hospital or the customer?
It's really measuring. It's really measuring a particular KPI that you have. For one of our hospitals doing diabetes, it was around the A1C tests that diabetic patients need to, they take blood work to see how they're managing their diabetes every 90 days. And if you have a score of 9 or greater, on an A1C test, then you are high risk of having health complications. And they have too many of those patients becoming a problem. And so they're measuring right now, there's just an ongoing trial going on where they're trying to reduce that to lower than 7 or 6. And they strongly, the CEO of the Diabetes Center, believes mobile is the way to do this. It's going to make a significant improvement because it's around engagement. If you engage regularly with that patient outside of the health system over a period of 90 days to remind them to not eat sodium, take some test their blood sugar, exercise, eat healthy, blah, 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 that prescription does make them healthier in general. And so they're actually measuring those patients. Another one, emergency room app, is they had too many non-emergent patients clogging the emergency room, and those patients did not have an awareness that there was a new health clinic or urgent care that just opened up 2 miles down the road and was cheaper and was always less than 30 minutes. And what's the challenge is when they show up and present themselves in the emergency room, if it seems like they're non-emergent, they don't want to tell the patient, oh, you don't look sick, so go to the urgent care because there's liability there. So they haven't been telling them, and they haven't been trying to make that awareness. So they're actually prescribing an app when they check in at the emergency room, sort of like the way you check in at a restaurant. You get the buzzer, the thing to tell you when it's ready. So they say, here's an app. It'll show you the current wait time of the emergency room. And that's all they tell them. And then once they get the app, they're able to see other function. And they're like, as they're scrolling through the app, it's a 4-hour wait time. But there's an urgent care. Let me tap on that. It's only 2 miles away. It's a $75 copay for the urgent care. It's a $275 here at the emergency room. I think I'm going there. So they're actually measuring first-time usage of the urgent care. So how many new first-time users are they getting, and are they? The second question you're asking is how they find out about it. Was it through the app? Was it through other means? But so they're actually tracking that measurement right now, and I think those results are in. I'm not sure if I've seen them yet, but it sounds like everything's working really good there for that. So actually, the service lines, the domain experts in those fields have the metric, have the KPI in their minds that they say is a problem. They measure it beforehand, and then a period of time later, they take new measurements and see the improvement.
And then what we do on that topic is our company has a number of measurement-oriented experts that figure out, okay, now that we know what their KPI is, how do we make sure we can support those measurements in our platform and actually have the impact? So it really is kind of they're the experts, but we're the expert partners in ensuring that these measurements.
That's the interesting thing is we're very connected with our clients through the process of their apps. Now they build a lot of their apps, but they'll come to us a lot and they'll consult. And they'll be like, well, do you think an app would work in this area? I was thinking of configuring this or that, and we work with them on that. Dave was referring to a lot of these other apps that aren't blueprints right now. We have other projects going on with clients that we've engaged with that, it hasn't been proven out yet, so they haven't made the blueprint list. But they're in other areas like congestive heart failure, and some other areas now that we're always looking at. We're going to add to that catalog if we feel that this can be utilized by hospitals all around the country.
Great. And then just, I think we've got time for one more. Dave, you mentioned earlier Blue Dot wayfinding. Can you elaborate a little on how you're supporting Blue Dot interior wayfinding?
Yeah, that's a good question because it's actually a recent development, and we'll actually be making an announcement at HIMSS or around HIMSS related to this. But we have 2 different location-based technologies built into our platform. One is Blue Dot wayfinding. So the way that works, obviously, you have some sort of indoor positioning system in your hospital. If you don't already have one, we can get one installed with simple eye beacons. They're not very expensive. And then a layer of mapping. So mapping has to be done. But once all that's complete, we've got an SDK integrated into our platform that allows you to quickly create a number of different Blue Dot wayfinding scenarios. And it's not just for wayfinding. Some clients are asking to use that for asset management. The nurse wants to know where the nearest piece of equipment is on that floor in order to do a procedure. and able to see that, each of the assets is tagged with a beacon, and they can see where the equipment is. So there's a lot of internal workflow applications as well for this technology. The second technology we have built in is actually location-based messaging. So on top of just a lot of the blue dot wayfinding solutions don't have this piece, which is now that you are in a particular location, you're going by a point of interest, you can actually get a message, or better yet, what if you're dwelling in one place at the same time and you shouldn't be, like you've waited too long and you haven't been seen by someone yet. You can actually have like dwell time messages. I've been here over 30 minutes, so I'm going to get a special message as compared to someone who's only been here 5 minutes. And so the combination of that blue dot location-based with the indoor positioning plus the location-based messaging is, again, kind of the possibilities are endless in terms of what sorts of problems you can solve.
Great. Well, thank you so much, Dave and Bob, and thank you all for joining us today for our webinar. I know we've enjoyed sharing with you what we're up to here at MobileSmith, and we'll be happy to follow up with you guys. If you have any questions that we weren't able to get to today, we'll reach out and see if we can maybe talk through a customized demonstration for you. And if you do want to, feel free to reach out to us as well if you have specific questions. Thank you all so much, and have a wonderful rest of your day.